Africa Science Dialogue, closing the gap between science.
Now, when we talk about One Health, we talk about a situation where animal, human, and environment health are considered and are interconnected. And many countries are trying to find a way in which they can bring experts from all these different fields together to work towards a common goal. Tanzania long realized this, and they have been doing well. To tell us more about this today in studio, I have Dr. Abubakar Shaban Hoza, who is a PhD, who is a senior lecturer at the Sokoine University of Agriculture in Tanzania, specialized in infectious diseases. Like I said, he has a PhD in medical microbiology, and he's a veterinarian by training. His research is basically on antimicrobial resistance. He works with human tuberculosis research, biosafety and biosecurity, and whatnot. Dr. Hoza is working with Africa One Health University Network, Tanzanian chapter, as a continuous professional development program lead for in-service education on One Health. He's also a member of the National Antimicrobial Stewardship Technical Working Group in TZ, and is a technical working group member of the National Biosafety and Biosecurity Technical Working Group. He has worked as WHO Afro-AVOC Assad trainer in Malawi, Kenya, and TZ. He speaks One Health fluently, as you're about to hear. Now, Dr. Hoza, thank you very much for joining us for this podcast.
Pleasure for having me.
Tanzania is an exemplary country, and we had this discussion with someone before, and the discussion was about how, at the very highest level, you've managed to anchor One Health. I see the Prime Minister speaks about One Health. The Prime Minister's office speaks about One Health with conviction. It understands the need to play a role in this whole goal. Tell me, how does the involvement of the highest office in the land help you in achieving your goals?
Well, thank you very much for a very nice question. I would start by saying the history of One Health in Tanzania, particularly at that high level, started way back in 2006, 2007, when we had a Rift Valley outbreak in the country. By then, different sectors responded differently on the outbreak. The animal health sector responded differently because it affected also the human health. And then it was at this particular time when it was realized that the anthrax outbreak, the Rift Valley fever outbreak, cannot just be addressed by tackling the so-called by dealing with the animal side alone, because there are so many risk factors that impact the human sector as well. So in order to address that problem, you need the different stakeholders from the animal health side, to come together to look at the risk factors that leads into transmission of the disease, the control of the disease. But again, we should realize that normally the Rift Valley fever outbreak follows the long spell of drought, and that is about the climate and the environment. And then you have very heavy rains, and because of that, you have the vectors, the mosquitoes breeding, because now you have conducive environment for them to breed, and then you have the arboviruses, which are actually the ones causing the RVF, Rift Valley fever. So because of that challenge, then the ministries, the livestock ministries, the health ministries, and of course the environment, the ministry responsible for environment, the vice president office, experts came together, and from that it brought up the ideas that there are some diseases that we cannot work in silos. We need to come together And then the whole idea started from that period. And then based on our government structure, the prime minister is the overall overseer of the day-to-day government activities. Mm-hmm. So the ministries are implementing, the different sectors are implementing. So the prime minister office has that role. So because of that, then we thought, no, it's high time now. We are not only addressing the Rift Valley fever, but we have other challenges that affects both human, animals, and environment. We need to have one single entity that can be heard by everybody in the country. And then we started as a desk at the Prime Minister's office. So we had the officers we called them focal persons from the Ministry of, we started with the Ministry of Livestock, because these are the key ministries of health. So we had focal persons from the key ministries working at the desk, addressing challenges that are emanating, that are perceived as One Health challenges. So from that, we had a lot of success from this desk. We could develop different control strategies, documents together, because me as a veterinarian, I know how to control a particular disease in the sphere of my profession. But the same disease also affects humans. So if I don't control the disease in I would say my clients, the animals, it will spill over to the human. But also we should, as you clearly said in your introduction, we should not forget a third entity here, which is the environment. So because of that realization, and because of the exemplary work that we saw from the desk and these focal persons, then we of course the baby desk grew up into a section, a section with a deputy director, a section with a budget. Of course, the budget may not be sufficient, but at least now there is a budget allocation for that section to undertake One Health activities, the coordination, the collaboration issues. So the One Health sections now links different partners, the implementing partners, the funders, the international organization, and different other implementing partners who are working on areas of One Health interest. And the Prime Minister has, office, and the Prime Minister himself has high interest on the One Health because of the achievement that we have realized by working together. It helped solving a lot of timely response to disease outbreak, reporting of disease outbreak, and of course resources. It was easier for soliciting for resources to respond to certain outbreaks. So in that, the One Health section now has grown bigger, and now they have even more human resource, and of course the funding. So you can see how the top government has very big interest, high interest on One Health, and it gives it the highest priorities. We had some we still have some outbreaks of cholera, which basically was being handled as a mandate for the Ministry of Health. But because of the realization from the One Health perspective, from that top office, said, okay, we every day report cholera, but where does the cholera come from? It's about our environment. It's about environmental hygiene and sanitation. It's about having potable water. So all these people now, everybody is now included in the strategies for control of cholera. So you can already see in that researchers from the universities, from research and development institutes who are actually working on areas of One Health interest. The Prime Minister's Office One Health section has a database of all these stakeholders who are working on areas on One Health, be it antimicrobial resistance, be it biosafety, biosecurity, be it zoonotic diseases, and through that One Health section, we were able to develop about I think one, we were able to have a list of prioritized zoonotic diseases. So we had from the lesson of RVF. So we have Rift Valley fever and other hemorrhagic diseases, Marburg, Ebola, but also we have anthrax because of the magnitude of the disease as we can put it. So we have anthrax, we have brucellosis, we have also avian influenza, but also we have African trypanosomiasis in that, and then we have rabies. So through the One Health section, we were able to develop the strategy for rabies control. We developed for anthrax and of course brucellosis, and then the One Health section, using the institutes, has been able to build the capacity to various stakeholders, be it at the subnational levels. We are talking of the livestock officers. We are talking of healthcare workers. We are talking of so many players who are in the community, because the bottom line is we want to have health promotion for all. Mm-hmm. So the community engagement, we do that, and apart from that, we have the One Health section from the Prime Minister Office, of course, coordinated a very big campaign on addressing issues of antimicrobial resistance, and we came with a very big campaign which actually won some awards with regard to community engagement on holela itakukosti. Yeah, that we should not be misusing antibiotics. But we are doing that on antibiotics, antimicrobial resistance, but also the same campaign, very big campaign. Of course, we did that through the coordination of Prime Minister Office with other implementing partners, through the USAID support. So we are doing for among the zoonotic diseases, we are doing for anthrax. We are doing also for brucellosis and rabies, trying to educate the communities, bringing the awareness and behavior change for the communities on prudent use of antimicrobials in both animals, humans, but also use of antimicrobials in agriculture. But also we are talking of behavior change for diseases like anthrax, brucellosis, You know, brucellosis, anthrax. If you consume animal products that are, of course, from animals that are affected by these diseases, you are likely to contract those diseases. But then we have a big problem of rabies. So we had those campaigns, and we have those documents that have been developed by the One Health sections. But the bigger picture is having a One Health strategic plan, which is the second review after the first one, which ran from 2015 to 2020. So we have now a second document, which actually involved a number of stakeholders. So you can realize we have several strategic objectives, including involving training institutions, and not only the higher level, up to the grassroots level, primary schools, secondary schools, and we have been training these people on issues related to One Health. So we are building that capacity, awareness creation on antimicrobial resistance, zoonotic diseases, and the Prime Minister of section, it doesn't work alone. It has also established various technical working groups. So there is a technical working group working on awareness, surveillance, disease surveillance, and of course reporting, capacity building, research. So you can already see how important that is being taken by the Prime Minister's office. So that we do. So the training also has gone to the subnational levels. So we train in-service professionals together with the Prime Minister's office from the livestock. We are also involving the wildlife, because you know, of all the zoonotic diseases we are talking here, the majority, 75%, of course, are coming from animals, and wildlife plays a bigger role. You talk of hemorrhagic fever diseases. You mention wildlife. So it's important that we also bring on board every important stakeholder, so we engage them. We also have trainings, especially at the border areas. So the Prime Minister's office, in collaboration with other implementing partners, FAO, Food and Agriculture Organization of the United Nations, WHO, and other breakthrough actions, have worked together in border regions to actually train, build capacity of the communities and professionals in those regions. But then after the outbreaks, the Prime Minister's office, One Health section, has been conducting after action reviews to learn on the lessons during the outbreak. Where did we go right? Where did we go wrong? Why did we fail? Where did we succeed? Can we take the best practice so that we improve on our failures? So the One Health section is doing that. And only last year, the Prime Minister's office One Health sections conducted the first ever One Health international conference, which brought together One Health experts from across the globe in Tanzania to discuss issues, the different milestones we have achieved as countries on One Health. And that you can imagine, you know, in the context of Tanzania, and I believe in many other countries, a Prime Minister's office holding a big international conference, that doesn't really come up very, very easy. Yeah. The Prime Minister's office is, people would expect they are dealing with policy implementation, you know, coming with that idea of having this One Health conference was a very big achievement, showing case where we came from and where we want to go. And the Prime Minister's office also realized the contribution of different individuals in bringing that level, the One Health, to that level. So we even had awards for One Health champions, both in research, but all those doing in capacity building. So it was something that was exemplary, and we should commend the Prime Minister for championing the One Health. Of course, there might be some challenges, but I would say we are a working class for people to come and learn.
Yeah, because as you narrate your story, and I was even unable to ask some questions in between. You narrate of so many successes in between, and we can point them back to the government buy-in, and all the support that it has offered. And one thing that was running through my mind is, with the government with the Prime Minister's office being disinvested and making the deliberate effort, including what you've last said, the conference, which is quite a big thing to come from the Prime Minister's office. Of course, it gives more attention to what you're doing. It shows the intentionality. Haven't you had some political actors who are trying to sabotage this and make it political, like for political kind of interest?
No, in Tanzania, not really. Probably I have not mentioned of one thing which is a big achievement. Actually, we have AMR, antimicrobial resistant champions from the parliamentary wing. So you can understand how and the chair of that wing is a member of parliament. So they have their chapter. So you can understand we have that strong political buy-in from parliamentarians. So basically that we have not experienced, and that's why we also have this technical group on biosafety, biosecurity, because it checks on the threats that might come and sabotage all these efforts. So the only thing that we, as I say, we need to go down at the subnational levels to create that awareness among the community leaders and the other lower level leaders. Because at the level of the ministries, Prime Minister's office, super. The only challenge I see is attrition. Because sometimes you have a minister who clearly understands and speaks One Health. Today is a minister for health. Tomorrow is a minister for say Home Affairs. Maybe Home Affairs is closer to One Health because we need people at the border control. But somebody today is a minister, tomorrow is not. Tomorrow is not. And there comes, yes. And tomorrow, and there comes somebody who has no interest. So you start all over again. So you are not making progress. Then you have to make some advocacy. And that applies also to other technical people, the permanent secretaries, the different directors. So that to me is the only challenge I would say that holds the speed that would want to move ahead.
Yes, and actually I wanted to ask about this Prime Minister's office buy-in. Is it about the office or the Prime Minister himself as an individual?
Well, it is about the Prime Minister office as an office, because today, if we don't have His Excellence Kassim Majaliwa as a Prime Minister after the election, the One Health section in that office will still remain with the assistant director for One Health. He will be there. There will be budget allocation. So regardless, His Excellency Kassim Majaliwa is a prime minister or not. So it's something that is really well integrated into the structure of the department. So much as himself is a champion of One Health, but then we are not that worried because after his retirement, we still hope he's going to be an ambassador for One Health. Yes.
And that whoever comes with just
yes, exactly. Yes, exactly.
Now you've spoken about capacity building at the lower levels and the intentionality. I know it's there.
Yeah.
One of the biggest challenges that scientists will have going to community levels is how to get the community leaders, the faith-based religious leaders, and everybody interested, and not only interested, but to understand this message. At the grassroots level, how do you make sure that the people who probably are the most affected have the same kind of buy-in, understand exactly what you're doing? You know, how exactly do you get to those people right down there, where now you're trying to create inroads?
Thank you very much for that question. And to answer that, let me use one living example of what we are doing through AfroHun, of course, in collaboration with the Prime Minister's Office. In Morogoro, AfroHun has what we call One Health demonstration site. It's an area in the district of Kilosa. And these sites, we call them One Health demonstration sites. Why? Because we have a very big interaction of livestock keepers. We have the nearby wildlife, and then we have the human. But again, we have the agriculture. So in that district, we have showcase where we engage with the communities and the primary school children, where we together co-designed the solutions for the One Health challenges. Because one thing that we need to understand is that One Health deals with complex problems, very complex and wicked problems, which cannot be solved by individual sector, by single discipline. You are understanding, or my understanding as a veterinarian, is not necessarily the same understanding of a human health specialist. We might have, as professionals, come up with very, very complicated solutions, which we perceive as probably these are going to solve community problems. But for the communities themselves, they don't perceive like these are going to give them solutions, because they have their own community social cultural behavior. So when we went down to Kilosa and other communities, of course, we sit together with them. How do we solve this problem? I'll give you one example of rabies. Normally, the livestock keepers, I don't know what is the situation in Kenya. In Tanzania, these are the people with so many dogs. Same here, right? So when you are in the vaccination campaigns, they would bring a very fierce dog, only one dog, and they will have a certificate, right? So when you go around communities asking whether the dogs have been vaccinated, of course they tell you yes. Do you have evidence? Yes. They bring you that single certificate, while they have other dogs. So we sat down with them. Why that? And then we could come up with very, very interesting information about that. They said, well, you know what? we are only vaccinating this dog because it's a wild dog, it's the only dog that we depend here when we have thieves, and it's a courageous dog. So we vaccinate it, hoping that is likely to bite somebody, forgetting the other dogs. I mean, ignoring the other dogs. But when we talk with them, they tell you solutions that you can solve your problems. You understand? So what we do, we sit with the community leaders. We tell them the science part of the One Health problems in a very simple language, and then we ask them. Now we want to bring it to the community. How best do you think we should communicate to them about these all risks? So they will tell you, no, that they won't understand you. They won't understand you. They would say, if you do this, yes, they will do this. And that, working with communities, working with the common citizen, has taught us a lesson during the Holela Holela campaign with the breakthrough action, and of course under the coordination of Prime Minister's office. We sat together with religious leaders, community leaders. We also engaged the artists, the local media, the artists like the Omondi, the comedians, and the local Mwananchis who came there not understanding what antimicrobial resistance is and why is it important, not understanding the challenges of rabies, not understanding the challenges of anthrax. So we talk to them on prudent use of antimicrobials, and how does it bring to the resistance. So we talk to them in a very simple language, and it was them who said, now we are coming up with a slogan, and that is Holela Holela. They came up with that, yes, that concussion. They come up with it. It was the artist after we trained them. So it means, and if you travel to Tanzania today, you say Holela Holela, they say itaku cost. So you don't use antimicrobials haphazardly.
It's just become a catchphrase. Everybody now.
Yes. So this is the common language of a normal citizen. But if you tell the citizens, for antimicrobial resistance, so what? Yes, you become so technical, and they don't. So in whatever interventions we are doing, we have learned a lesson. We sit with the communities, we educate them first, we build the capacity in a very simple language. Even the ICE materials that we are able to produce, I tell you, even you media guys, you understand how you communicate with the public. I can say something here with all these interviews, you can put it in a very simple language and everybody can understand. So these people, we realize that if we don't engage them, whatever interventions we are putting on in the communities are not likely to be successful. Yes, they have to bring we have to co-create the best solutions with them. Yeah.
Yes, and it's interesting you've mentioned the media, because beyond them amplifying the voices, they also need to have the accurate and correct statements.
Yes.
And so I think they also need to be trained as well.
Yeah.
But throughout your work, now that the media is involved in the amplification of the issue, getting to the grassroots, the Prime Minister's office, you've realized that you have to have so many players, definitely. But as you said, it's not, political players have not really hit a battleground. I believe you have to contend with misinformation and disinformation once in a while. That affects your work.
Yeah.
Have you had such cases, and how do you deal with that?
A lot. especially during big outbreaks. During COVID time, there were a lot of miscommunication, misinformation coming out, and this is where we as researchers, we as One Health experts, need to bring this advocacy to the the political makers, policy makers, because it's very important. When we have outbreak, we want to discuss with them that it is important that we communicate about the risk, because this risk is real. And how best can we communicate this? There has to be that buy-in from the policymakers, because that's the biggest challenge in many African countries when it comes to risk communication. Because if we don't communicate, and we don't communicate properly and oftenly, we create a vacuum. And who will fill this vacuum? It will be the social media, the bloggers, and this will have no correct information. They will have the wrong information, and the public, during these outbreaks, at times where we have big risk, demand for information is very high, and it is critical that the public gets information, and the right information. Not communicating is not a solution, because the biggest fear would probably not be an Ebola virus, but it will be the outrage from the public for not communicating rapidly, effectively, and that would bring a lot of challenge. So that challenge is there. The challenge is there. Our policymakers need to have a clear understanding, because some of the outbreaks, so to speak, if you report, you are likely to, one, you are also protecting the other people. Could be your neighbors, even if you have a contagious disease in a village. If one house has a case, and if they hide a case, of course it's going to spread. So if you don't communicate properly, and you don't educate about the risk, you are likely to have a lot of problems. This is in the context of a village, but it can spill over outside the borders. It can affect the whole world. Diseases have no borders.
Yeah.
You can say that today Kenya, we don't have Ebola, but mind you, Hosa came all the way from Tanzania to Kenya, and because of you hiding, Hosa goes with Ebola to Tanzania, and then you start having cases in Tanzania. So it's important to communicate. It's important to communicate regardless of many other factors, but you can still communicate in the right way.
Okay.
Yeah.
So now, a lot of African countries are contending with infectious zoonotic diseases over time. This case goes, another one comes, and of course, with the many challenges in funding and everything. Do you feel like Africa has the sufficient skill and probably even funding, but can it build solutions that are homegrown for some of these problems, so we don't keep on having repetitive incidences?
Yeah.
Like, the other day, we have had so many cases of rabies in several countries, Uganda,
Kenya, Tanzania, yes.
and the southern of Africa.
Yeah.
Do we build, and so many others, do we have the capacity as Africans to keep up with the rate of reappearance, reemergence of this? And if so, and if not so, why?
Well, maybe I start with the capacity. Do we have the capacity? In terms of human resource, I would say we are not that bad, but still, it's not sufficient. It's not sufficient in terms of understanding the One Health concept. That is lacking. We have technical capacity from different sectors, but realization of how One Health can contribute to co-create solutions is still a challenge. Many professionals still don't understand the role of One Health, and oftentimes you hear somebody saying, I'm a One Health expert. I mean profession, which is a misconception, because One Health is meant to, I would not say break silos, but I would rather put it like bridge the silos. Because if you break the silos, that you are still siloed. So One Health should bridge the silos. There are some expertise that I have as a media people, how to communicate with the public, that me as a HOSA don't have. But I have all the knowledges about the diseases. So if I don't work with you, that means we will fail in terms of communication. You understand? Yeah. So that capacity is still lacking, but we are not that bad. The biggest challenge that I see is resource, competition for resources. This is still a big challenge, even in Tanzania. Not in even in Tanzania. Resource sharing is quite a challenge. So that is a big challenge. That's why we are not seeing an end to all these outbreaks. They are coming every now and then. So resource sharing is a big problem. But also another area that we need to strengthen is on data sharing, data and information sharing. Because if you don't share the information, you hide, these outbreaks will come. They will definitely come. You know, me as an instructor, I usually I teach microbiology, and I tell my students that microbes are very smart. They are smarter than us. So if you hide them today, they will come. They will come. You cannot hide them. So data sharing and information sharing is a big challenge. So another challenge why we are having this, as I said, we are not yet reached that point where we want to bridge all the silos. People and professionals are still having that siloed mentalities. I think it's fear of my job. You understand, fear of my position. I think that is one challenge that is eating Africa. Yes. So we unless we address these in-house problems, we will continue seeing a number of outbreaks. Yes.
But when you speak of Tanzanian situation now, as we conclude, it seems like you have a clear roadmap to what's supposed to be done.
Yeah.
The buy-in is there, which means the intention is there, the human resource is there, and with the strategic plan now, that's been there for a long time, and you're now in the second phase. Definitely, you can see the future.
Yeah.
So what next?
What next is basically is to advocate for local funding, specifically for issues related to One Health. This is important. We as the government of Africa and Tanzania in particular, it's high time now we do not rely on foreign aids to service our health. It's high time that as a government we start allocating our own resources to fund One Health activities, and that I have clearly indicated in the policy brief that we developed with the Prime Minister's office. We have clearly indicated need to increase financing, One Health financing. So if we do that, that means we are able to do our own surveillance with our own money, which of course we are doing. We are doing surveillance. We report. We can respond. So we need to increase financing in the One Health section, and all other. I mean, at every level, from the subnational levels, regional levels, there has to be funds for One Health activities, be it rabies campaign, be it antimicrobials, fighting for antimicrobial resistance, be it for zoonotic outbreaks, be it for climate issues, be it for biosecurity threat. And speaking of that, I don't know if this is, but because it was in the media, on Sunday when I was flying to Nairobi, our flight was delayed for 3 hours. Actually, it had to be recalled back 25 minutes after taking off from Jomo Kenyatta International Airport. And the reason put forward was the fear of leakage of biological materials. That is a biological threat. And therefore, the good thing is that KQ could handle that very well. So if we that is a very small example of how these One Health challenges can come from different angles. You understand? They were suspecting leakage of TB, which I've said I've worked for many years. You can understand the threat in the public. So the One Health challenges, as I said, they are very complex. So you don't know where they will come up. So you should be ready in terms of finance, in terms of your human resource, should be ready. So what next is advocates for increased budget allocation for One Health activities, and of course continued capacity building and the advocates. Yeah, we should not sleep.
Wow, we should not sleep. What a note to end on. You see, this is Tanzania's story. As you've heard, Tanzania has made a lot of strides. From the highest level of government, the Prime Minister's office, is buying. And they're going all the way down because the people who are most affected are the people at the grassroots. You've heard it clearly that although they have made all this progress, they have not yet gotten there. And they have the expertise and they still have the needs. They have the needs for funding. They have to keep on increasing capacity building. There's so much that needs to be done. But clearly, as we can all see, Tanzania is a case study. We can learn from Tanzania. The things that we were told in the first few minutes in this discussion here with Dr. Hoza are just like amazing, because like I've seen in previous discussions about One Health, there's always a very, very big problem in getting government, political goodwill and government buy-in. And once you have that, like in Tanzania's case, then everything flows very nicely. We hope to be having you again in this podcast, Dr. Hoza, because I think we will keep on learning from Tanzania's example. I've seen from some other countries, they also have some places where they seem to be doing very well.
Yeah.
But the one consistent message is we cannot say we are there yet.
Yeah.
We cannot say we are there yet. Africa is going to host 2.5 billion people in just 25 years to come. Of course, the problems are going to increase over time. And so we need these experts to help us solve all these problems. Thank you for joining us once more.
My pleasure for having me.
And thank you for visiting Kenya. I hope you've been enjoying it.
Thank you very much. Yes, so much.
Thank you very much. We hope to have you some other time. And we hope that you continue staging every One Health activity in Tanzania like it is the last thing you will do. And we'll keep learning and following. Thank you very much for joining us on the Africa Science Dialogue today with Dr. Hoza, who speaks Swahili and English as well as he speaks One Health. Until next